All right, so today I am going to be talking about the continuum of community engaged research and particularly the how to ethically participate within this continuum of community engaged research. And so a little additional background about me. Jackie gave an overview of my current position, but I wanted to also share a little bit about my previous experience and also my kind of other activities within my position. And so from the academic side, my PhD is in medical anthropology, which is very much a field where you are out, you are in the community, you are participating. And so it really is a natural fit with community engaged research within the health and medicine fields. And I came to Hopkins as part of the W.K. Kellogg Community Scholars Postdoctoral Fellowship, which unfortunately no longer exists. But this was a program, the community tract, which is where I was placed, was a program at 4 different schools that really aimed to train, new scholars in CBPR specifically, and create a network of scholars that then could go out and continue to promote community engaged research and CBPR. And so I've stayed at Hopkins since that point. I've really enjoyed that, and so I've been here since then. And also since then, I've been an associate editor for the peer-reviewed journal Progress in Community Health Partnerships, Research, Education, and Action. And I've been part of that board since 2010. It's something that I really love being a part of. And so it has been quite a while. A lot of people, when they serve as an editor on a journal, often don't go for that long, but I really enjoy that process. And I really enjoy the network of folks dedicated to community engaged research and the discussions that we have. And so I do that. And then I teach in the School of Public Health, the Introduction to Community-Based Participatory Research. I've been doing that since 2017. And then as Jackie mentioned, a lot of my work involves some form of community engagement along that continuum. And then I also have some experience as a community partner. So on that other, side, if you will, the other flip of the coin. I serve as a patient research partner for an international research group of academic physicians and researchers. And so while I do understand, because of my position, I do understand some of the research aspects of that group. It is a subject area that I have zero knowledge of outside of being a patient. It does provide a really great opportunity for me to kind of see what it's like operating as a community partner with different experiences than the doctors who are treating the patients, and the ways that I get to participate and influence the research that they're doing using my lens as a patient. So I just wanted to share that background and the lenses that I bring when discussing community engaged research. And so I think it's always important to start with that basic question of what is community. And, a simple definition is a group of people who share a sense of identification with an emotional connection to certain geographic areas, interests, or experiences. And so it's really, important when we talk about community, because that is kind of, vague and term that could be applied to many groups in different ways. But it's really important that, while we often say community as this monolithic thing, that communities are incredibly diverse. They are not homogenous, of course, and seldom speak with one voice. And so it's always really important to kind of keep that, in your mind. And it's always really also important to, when you're working with community partners, to ask them, how do they define their own community? And to use that as the kind of definition, if you will, of your community partners. I'm sorry, I think there we go. All right, so when we look at communities' experiences with research historically as well as now, we hear a lot of times, some negative feedback such as, the fact that we engage in helicopter research. So researchers often will, fly into a community or an area, whether that be virtually or on the ground. They'll study a population, collect data, and then they leave. And that's that. Often the research may or may not be of interest to community members or a priority. We also hear from people that they feel that research often is trying to prove something they already know. They're like, why do you need to study this? Like, I could tell you that this is what it is. This is what it is. This is what you're going to find out in the study. And it seems kind of pointless to them. We're asking the wrong questions. Also, other things that, you hear are that universities will implement and evaluate really great programs, but then once money runs out, they leave and the program stops because there's no support, both in terms of human capacity as well as, financial resources to continue that program. And then also commonly, there's criticisms that the outcomes of research are not known. They're not shared back with community members, and the community members don't see benefit. They don't know what happened to it. They don't see any improvement after having participated as a research participant in these studies. And just kind of bring it a little bit closer to home, I wanted to share a couple of quotes from focus groups that we conducted here in Baltimore in 2018. And these focus groups were focused in a formative stage of a study looking at community engagement and what some things that we needed to consider within this upcoming research project. And this was these were focus groups conducted with Black sexual minority men. And these are just 3 quotes I pulled out to kind of demonstrate some of the issues that came up with more traditional research. And so at the top, one participant said, "So is the research being conducted just to bring money in? It brings a lot of money into the different universities and, doctors who are doing this research. But what are they giving back? Because we're pulled in and they offer you these little stipends and people run to them because somebody may need that stipend every now and again. But how are you really giving back once it's completed?" Another participant said here on the left, bottom left, "I mean, the oversaturation of studies in the Black gay community is becoming overwhelming at this point. I should say because it's a lot going on." And then kind of similar to that, on the bottom right, another participant said, "Nothing has changed. People sit around the same table asking the same questions last year." And so again, this idea of there's so many people out there, there's redundancy, doing the same thing, not giving back, the community or communities not seeing any benefit and feeling exhausted and used and not benefiting. And so, thinking about that, then why would, if there are some of these negative ideas about research, why would communities want to participate in conducting research? And there are really a lot of reasons, some of which are on this slide, such as having a role in describing the health issues and the priorities affecting their communities. And so having an influence in making sure that the work is of, priority to their community. Being able to adapt or design new programs that fit culturally and are appropriate, conducting evaluations of their own programs that are already in existence, providing answers or findings to their communities or service populations, and using this data to advocate both for policy change and or additional funding to continue the work. So, these are just some of the reasons why communities might want to participate with us as we are conducting research. And then importantly, it's really critical that we think about the importance of community participation. And one of the critical things here when we think about this is the fact that we've had the persistence of health disparities. A lot of researchers at Hopkins and elsewhere are really focused on trying to address health disparities and move towards health equity, but we're just seeing this persistence of these disparities despite all of the work that we are doing. Also, there's a greater demand by communities for equity and research relevance stemming from a history of abuse and mistrust. And through participating, you really, it can be very empowering for communities to be part of this process, as well as, they're protecting their community by having access to the process and having some decision-making control. And also, it's important that we have community participation because we have seen really, really large limitations of our current research approaches in addressing challenges to research translation. A lot of great work being done that never gets translated or gets translated, so much further down in time that it maybe is not as relevant or as important. And so, we can address this through community participation because we can identify more effective solutions with community partners, and there's an increased likelihood of programs and interventions being accepted and, importantly, sustained over time. And so I think it's always good also to have just a starting point of a basic definition. And so I wanted to provide one for community engagement because I've said that term, many times and will continue to do so. And so this is a definition from the CDC, and it is the process of working collaboratively, with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting the well-being of those people. And there are 9 principles of community engagement. I don't want to spend too much time here, but I do think it's important to note them. And again, these come from the CDC. And so before starting a community engagement effort, it's important to be clear about the purpose or goals of the engagement effort and the population and or communities you want to engage. It's important to become knowledgeable about the community's culture, their economic conditions, and so forth. And likewise, it's also important to learn about the community's perceptions of those initiating the engagement activity. So the perceptions of research, the perceptions of your institution, getting some sense of that relationship. For engagement to occur, it is necessary that you actually go to the community, establish relationships and build trust, not only necessarily with formal leadership, but also informal leadership. It's also important to remember and accept that collective self-determination is a responsibility and the right of people in a community. This should never, you shouldn't assume any kind of participation, and it shouldn't be forced on anyone. For engagement to succeed, also, we need to be partnering with community, recognize that partnering with the community is necessary to create change and improve health. All aspects of community engagement must recognize and respect diversity of the community and, factor that into all aspects of the research process. And community engagement can only be sustained by identifying and mobilizing community assets and strengths, and by developing the community capacity and resources to make decisions and take action. And then finally, for engagement to succeed, organizations that wish to engage a community, as well as individuals seeking to effect change, must be prepared to release control of action and interventions to the community and be flexible to meet changing needs. And that one is really a critical one. And also, then finally, community collaboration requires long-term commitment by the engaging organization and its partners. So again, I know I kind of ran through these quickly just to give a sense, but I do believe we will share these slides. So those principles and the definition emerged from the Committee for Community Engagement that was established by the CDC and the Agency for Healthcare Research and Quality in 1995, recognizing the growing importance of community engagement in research and programming to address health disparities. And so engagement in research is not new by any means, But it really, over the last few decades, the focus of community engagement and research, the study of what makes for good partnerships, how they can be implemented and evaluated, and so forth, as well as the explicit use of community engagement and research has really increased. And one of the ways we see this is growth in a number of major federal initiatives. And I just have a couple of those here. For example, the Clinical Translational Science Award Program with NIH requires community participation in all phases of the translational process. The Prevention Research Centers with CDC is a network of academic research centers that work with communities in their areas to develop and evaluate large community changes related to chronic disease prevention and treatment. And then we also have the creation in 2010 of the nonprofit government-sponsored organization PCORI, Patient-Centered Outcomes Research Institute. And so we see, in the last couple of decades, the growth in the number of initiatives that are explicitly focused on or requiring community engagement in research and program efforts. We also see it in looking at the literature, and take this with a grain of salt. This is a quick Google Scholar search. It's not a systematic review of the literature or anything like that. So take it for what it is, but you can see the rise, the dramatic rise in the number of publications when searching for community engaged research or community engagement on the left. And on the right, that bar graph is community-based participatory research. So you can really see in 1995, it wasn't zero. I don't think you can't see the number. It was like 16 or around that. But, incredibly small. And then, going to in 2020, about 6,000 publications that year. And so you can see just this, great increase in the explicit use of community engagement in research. So let's look at the continuum of engagement. And so I will say that there are various representations of this continuum. This is just one. They are more or less similar to the one here. They all, start on the left with no community involvement and move towards the right towards more involvement. This one here goes to community-driven or led. Some may or may not go that far, but what's in the middle is usually pretty consistent, although the number of categories, the number of labels might, change a little bit. So they're not drastically different, but there are various representations of this continuum. And I chose this continuum, and this is the one I use, like when I'm teaching, because I really like it. And also I'm friends with the author Kent Key. We worked together, but I like this one because it was co-developed by academic and community partners. The partners of the Flint Research Coordinating Center developed this, and then they vetted it. They got feedback from over 300 community and academic partners within their network to get input on this. And so I really like that it's co-developed by this community and academic team that have a very long-standing history of working together. And so you can see, as I mentioned before, starting at no community involvement, moving to the right with increased community engagement, going from community informed, where there's a little bit of information, but the community members may or may not even realize that they are providing this information. So it could be just, if I go in and I tour a community center and talk to people, or if I go to a community event and just listen to people, see what's going on, something like that. Community consultation. So there is a more formal process of getting input and asking specific questions. that then academic researchers will go and use to inform their study. This is usually something that happens at the very beginning of the research design, and sometimes at the end when thinking about what to do with the research findings, or maybe to try to get some feedback on the findings. Community participation, that community members start having a more active role. Community initiated, in which community members bring ideas and really kind of, as it states, initiates the research, and then their involvement once they bring in academic partners, or it also can be other institutional research partners. Their involvement can vary. And then community-based participatory research and community-driven or led, in which the academic researcher really plays a supportive role only in the process. This is just another depiction that provides the perspective or the experience of community partners and academic partners at each of these stages. I'm not going to read them all, but wanted to include it because I think it's helpful in thinking about this continuum and what it looks like for various partners. And so, as I mentioned, I'm a associate editor for the journal Progress in Community Health Partnerships. And this journal emerged in 2007, and it was the first scholarly journal dedicated to CBPR. And so for many, many years, we only really wanted to promote community-based participatory research within public health and medicine, and really support the growth of that practice. But as I demonstrated or shown that, there's really greater increased demand and requirements for community engagement and research, broadly defined. As a journal, we expanded the focus to include community engaged partnership, however they are manifested, and really trying to promote, how these are modeled, because a lot of times there are the funding agencies will, say that community engagement is necessary or required, but there's really no direction on what that means, what that looks like. And a lot of people don't have formal training in this process. And so we wanted to make sure that we were providing models that people could read about, learn about, community engaged partnerships, and use to inform their own practices. And one of the issues that we have had since 2010, at least, I can speak up for, is the fact that people are often not clear in their descriptions of their partnerships. And we do advocate for not only having academic partners as authors on the manuscripts, but also having, community partners be part of the manuscript writing and be authors as well. And there's really not often good description of what this partnership looked like in practice. And we have very explicit, long, instructions on the instructions for authors page when you're going to submit the journal, but it just gets looked over almost. And it's one of the main reasons why we will immediately reject or return the manuscript back to the authors. And so this is something we talk about a lot, about, the need for people to be explicit in describing their partnership, the partnership processes. And so in 2021, myself and some of the other editors, we decided to write an editorial that really talks about this. And so the editorial was titled Promoting and Advocating for Ethical Community Engagement, Transparency in the Community Engaged Research Spectrum. And so that really provides the backdrop of what I'm sharing here today. And so again, going back to this idea that it's a continuum, right? It's a true continuum. There are not clear markings of where something ends, where something, begins, where it ends. There aren't neat boxes. And as I mentioned, there are multiple continuums. So the labels, can change, and how they're defined can change. And so it's not easy enough to just stick a label and say our partnership is at the community participation level. Because even that, it's not clearly defined of, well, in what ways did your partners participate? Was it in decision-making around the research question? Was it around the methods? Was it in how you utilize the findings? Was it all of those? It's not really clear by just putting a label on it, even if we could. And then also, a lot of times our partnerships fluctuate. They may move around the spectrum over time, and this can occur both within projects as well as between projects. And so again, with funding agencies and journal editors, wanting community engagement, but not really providing much, information on what that should look like, a lot of times what ends up happening is tokenism. And this can really create harm for community members. And so it's really important for all of these reasons that we are explicit and clear in talking about our partnerships and the way the partnership has influenced the research process. So I quickly want to just give a little overview of CBPR, because CBPR is often referred to or considered the gold standard in community engaged research. And I'll talk a little bit in further slides about how this is actually a little bit problematic. But because of this, people often will claim that they are doing CBPR, and they're not, which is really bad for the science. And again, it can be harmful to communities. And so it is, unlike the other categories, CBPR is a more well-defined kind of spot on the continuum, but it is often misunderstood and misrepresented. And so community-based participatory research, or CBPR, is a collaborative approach to research that equitably involves all partners in the research process and recognizes the unique strengths that each brings. CBPR begins with a research topic of importance to the community and has the aim of combining knowledge with action and achieving social change to improve health outcomes and eliminate disparities. So importantly, CBPR is not a method. Sometimes you hear that used, but it's not a method. It's a framework to guide the research process, and it can be used to inform any type of research. The aim, importantly, is not only to increase knowledge, but also to inform interventions, policy, and social change. So it's participatory with equitable partnership, and that piece is really key, equitable partnership at all phases of the research process, and it emphasizes knowledge generation and action. And so the research, doing the research is in itself is not the goal. It's part of that process, but it does not end there. It's to do the research and use that research for some sort of action. And so important to just note a few things that CBPR is not. It is not community-placed research. So if you are doing, an intervention within a community clinic, for example, that is not necessarily CBPR. It might be, but it is not just by virtue of you doing it in the community clinic. It's not sporadic inclusion of community, here and there, piecemeal as needed or as desired or as is convenient. And it's not symbolic inclusion of community. It's not tokenism. It's not having someone at the table, but that person doesn't actually have any real voice or influence. And so they're there to kind of check a box, but it's not meaningful, and it's not with any sort of influence over the process. I put these slides in just so that you would have them, although I'm not going to go over them, but these are the principles of CBPR. So going back to the continuum, as I previously mentioned, CBPR is often considered the gold standard of community engaged research. And generally more engagement is often seen as better. But really, community engagement shouldn't be measured by the extent of the engagement. That's not really what we should be focused on in terms of, saying it is better or higher quality or what have you. In reality, a more appropriate measure is the fit between the context and the level of engagement. And that's really what I want to focus on these next couple of slides. And so, is the level of engagement appropriate for the context? And it's important that we really think about this because bad community engagement is bad for science. And most importantly, it can be harmful to communities and further perpetuate mistrust. And so it's not just a matter of, wanting to have the best science or wanting to do this, it actually can be harmful. And so it is something that we really need to always be mindful about. And so I wanted to share this quote from Nicole Brown. When we were writing the editorial, we contacted Nicole Brown because this is something she has spoken about a lot, and she actually has a podcast where she talks a lot about ethics and research and community engaged research. And so we did reach out and talk to her, and this is a quote from that conversation. She said, "There are forces pushing researchers to be more engaged, but as researchers, we have a responsibility to not cause harm. Sometimes it is ethically and morally wrong to demand full engagement and full participation at every level of the process." And so again, this goes back to that idea of CBPR being a gold standard or more engagement is better, and trying to kind of remove that belief and perpetuate, that idea, because that actually should not be the measure, right? That actually can be harmful, and we don't want to be harmful. And so, these are just some potential harms. This is certainly not an exhaustive list, but there are harms with engaging community engaged research if we are not really being aware and mindful and thoughtful in our process. And so these can be, consultation fatigue. The men from the focus groups kind of talked about that, right? Like they keep coming in and asking the same questions. They're over it. Feeling used, feelings of tokenism, mental and physical stress. And so, the thinking about who your partners are and the physical requirements that it takes, for example, for them to participate, or the mental requirements of the topic or of the work. And thinking about the fact that this impacts your partners, but it also has subsequent impacts on, their networks, their family members, and their community. Also, it can be, create financial and time loss. And so again, not only for the individuals who are coming and participating and maybe, having consequences financially because of this, but it also is a diversion of those individuals' talents, their knowledge, and potentially, finances away from other areas in their communities in which it could be, utilized in a positive, more impactful way. There can be stigma from association with, the academic institutional partner. There could be stigma due to the association of the research topic and or because of the research outcomes. And that's really important to think about. And then often we see disappointment, from partners when institutions fail to follow through on commitments. And then again, all of this, can lead to that creation or perpetuation of mistrust or distrust. And so, as I mentioned, the real measure of community engaged research should be determined, or the scope and the extent of engagement really should be determined by the context, right, in which that research is being conducted. And so one of the really important considerations of that context is the need to balance scientific rigor and the community needs. So both of those things, right, have to be considered and maintained, right? We have to maintain our scientific rigor, and communities also have their needs that must be, acknowledged and addressed. And so there has to be that balance. And so, some of the things to think about in finding this balance include the importance of the health issue to the community, the methods used to address the research questions. Community partners might have very little to gain if the research process is a very complex resource intensive process that is going to take a lot of their times, a lot of their resources, and not really benefit them in any way, through that process. Maybe the findings are going to be beneficial, but that process of the data collection, maybe not so much. Also important to think about the community member capabilities and availability. What are they able to do, and what do they want to do? What are they available to do? And then also thinking about benefits to community member participation. So our community partners, what are they getting out of it? They're providing, their expertise, their time, their energy to these projects. But how else, beyond benefiting their community, how else do they benefit also as individuals? And so all of these things are really important in thinking about finding that balance between the scientific rigor and the community needs. Also, we have to consider the power dynamics of the context, the context within which the research is taking place. And so this includes kind of the bigger sociopolitical context. So the historical relationship between the community and the institution from which the academics are representing, as well as the relationship and the trust or distrust between community and particular people on that team. So, we obviously represent Hopkins, but people don't necessarily just assume we are one thing, right? Because we come from Hopkins. So that may influence their perception of us based on whatever they believe, good, bad, indifferent. But they also see us as individual people. And so that individual level relationship also has to be considered in thinking about the appropriate extent of engagement. And there is an adage that I don't know who originally said this. Anytime I look, I kind of go in circles of trying to find the original person who said this, but it's that partnerships move at the speed of trust. And I really like that saying. And I bring that up because of thinking about that trust, in partnerships and how that influences, the partnership and the scope and the extent of engagement. It is important to think about trust and recognize that trust is not binary. It's, we often talk about it as if it is, as either there's trust or there's not. It's there or it's not. It's absent or it's present. And in reality, there are different types of trust. And so, we might not have full trust that, in a way that you might trust, a best friend or a partner, that really, really intensive trust of like, I would trust you with my life. We might not be with our partners, but we might have really great trust. That is what we need, which might be functional trust. We trust each other for the purposes of this project. I trust that when you tell me you're going to do X, Y, and Z, that you're going to do them. I trust that you're going to show up to the meetings and continue this partnership, but I maybe don't trust you in other areas, right? So there are different types of trust, and we, do need to be kind of aware of what kind of trust do we have, what kind of trust is needed, and again, allowing that to influence our level of engagement, and also just thinking about the where partners are on the continuum can fluctuate. The types of trust can also fluctuate. You can move, in terms of trust over time as well. And so again, scope and extent of engagement should be determined by the context in which the research is conducted. And it's really important that partners agree upon this fit and remain flexible. So like I said, it can move within a project, between projects. The really important thing is that this is something that is explicitly acknowledged and agreed upon by all partners. And so to be able to do this, right, to be able to have a agreed upon fit, it's really important that there is transparency. And so that transparency has to be about the process within which the partnership is operating. And it's also really important when we're disseminating information about the work, so people can understand the partnership, understand how decisions were made, how we got to where we got. And so this includes disclosing the research process, when and how community engagement occurs or occurred, identifying who represents the community, again, recognizing that no one person, no group of people represent a whole community or could speak for a whole community because of all the divergent views within a community. And so in saying identifying the community, I certainly don't mean to name names unless they want their names named, but identifying, how did they come to be part of this group? Are they or did they come via the church, for example? And that just kind of, again, gives a sense of who is in this partnership representing the community and who's not part of that group. You're never going to have every voice represented, and that's fine. But it is important to recognize, kind of who is representing and who's not. And so being explicit in who is representing the community within a partnership. Describing procedures for decision-making within the research process. So to what extent was this academic researcher, decision-making, partnership decision-making, community decision-making, where does that power lie? And again, that might change at different times, but being, transparent about that. And then also in describing how research findings were disseminated or will be disseminated, demonstrating the role, that piece of demonstrating back to community, in addition to academic publications. So community engaged research, it's really important when we think about doing it, and that it takes a lot of time and investment, especially if you are wanting to utilize the CBPR framework. It really takes a lot of time and investment. And so it's our responsibility to be cognizant of that, and to be honest with ourselves and with our partners about what we can and cannot do. And one of the things that I have my students do in the CBPR class is a self-reflection of their positionality and how their positionality influences the way that they engage in research, and the way they may engage in partnerships, and how they may be perceived by partners, and just kind of think about that with a critical lens. And it's important that we are, maybe not to the extent of writing a paper, of course, but it is really important that we are willing to engage in self-reflection. And this is both from the lens of, me as a person, as well as me in my professional role, right? Because when I show up to my partnership, I am both of those things. I am me as my person, my individual, my personality, my interests, my passions, what have you. But I am also showing up as a representative of my research institution and utilizing my skills as an academic researcher to, work within this partnership and go wherever it is that the goal is to go. And so thinking about that self-reflection in both of those lenses. And, I want to point out that there's a focus on community identity. We talk a lot about, how is the community defined, who represents the community, what is identifying community. But we also need to focus, or put a focus on the academic research team identity. We need to be aware of our identity, the identity of our team as a collective. And this, I have a note here about insider outsider, because I think it's important to note that even if you or a member of your research team from the institution is also part of the community, that doesn't mean that self-reflection isn't warranted. A term for individuals in that position is insider outsider, because they are part of the community, but they are also they are distinguished or different by virtue of being in this role on the academic side, particularly, if you're working with communities where there's not great representation within academia, for example. And so you are set apart from the community at large. And so it is really also important to do that self-reflection and not, consider yourself exempt from that process. And I want to note that, true self-reflection in this capacity it can be difficult. But I try to encourage my students, and I will try to encourage you all as well, to try to take that discomfort as an opportunity for growth, recognizing the ways in which you may be unknowingly impacting partnerships, and trying to, address those, better understand why that is, recognize, can I address that or not? And kind of sit with that discomfort and allow it to be an opportunity for growth. And so, these are some examples of this reflection. And this is really more from the lens of researchers, academic researchers in their professional capacities, as well as reflecting on their institutions. And this is something to do, both before starting engagement, as well as when you are forming partners and maintaining your partnerships. And so these include your capacities, what experience do you have? Are you comfortable in diverse settings? Are you able and willing to share decision-making power or leadership? And there's no right or wrong. The important thing is to be aware of what you feel, what you're willing to do, what you're able to do, and being honest about that, right? So you don't feel comfortable letting go of the decision-making power. That's fine, as long as you're honest about that from the start, and everyone is aware of that, right? So it's not to say that there are things that you need to change or that are bad necessarily. It's really just about being aware and being able to communicate explicitly about these things. What are your liabilities? Do you have limited time to commit? Are there institutional policies that are going to impede some of the things that you might want to do with your partners? Are there data sharing issues that are going to come up that you have absolutely no ability to change? Right? Those are really important things to be aware of, again, so you can communicate with potential partners or your partners, and so that everyone is, on the same page. Resources, in terms of your institution. And then also really important are the needs, priorities, and preferences. Certainly partners are not going to always agree on everything, but where is the place, or where are the places that you have to have common ground for the partnership to be effective? There's a lot of places where you can have disagreement, but what are those critical areas where you really have to have common ground if you're going to be able to move forward with partners? And again, being explicit in that, so that if, partners or potential partners are not, don't have that same perspective or belief, or, whatever it may be, that that's going to be a problem off, immediately, and maybe this isn't the right partnership. So again, just revisiting transparency, really, it's vital to healthy community engagement as well as to the science. It creates a space for reflection, openness, and importantly for growth. And this is growth at a personal level, it is growth at a partnership level, and it is growth for the field. So we can really foster with this transparency more successful partnerships. We can promote advancements in the field of community engaged research. And importantly, we may be able to support institutional changes that facilitate community partnership and research. There are institutional barriers that we face. And if we want to do really good community engaged research, and particularly if we want to do really good CBPR, we do have to make changes to our institutional policies and culture to do that. And so being transparent, having, these processes, well described, and so forth can really be beneficial for that, as well as for so many things. And so I want to close with just this one last quote from a focus group participant who said, "That's the biggest one. It's got to be caring. If it's not genuine, don't do it." And I think that's a really important piece, because if it's not genuine, people know. If it's not genuine, you're less likely to be transparent and to be self-reflective and to be willing to work on and grow. So I really love this quote because it sums it down so beautifully. So thank you for being here today. I am grateful that all of you are interested in community engaged research. And I am always happy, not only now, but in the future, to discuss any of these topics with you further at any time. So I will stop sharing my screen, and I'm happy to hear any comments or respond to any questions that you may have. Thank you, Sarah. Thank you. Yeah, thanks everyone so much for being here. And please feel free always to use me as a resource if you need material. Like I said, since I teach a CBPR class, I have a lot of material that I'm happy to always share with folks. So, thank you so much.